Hello, everyone. Before I start, I would like to share with you a book that I created. It's called Diving into Dentistry, a compilation of 100 questions for every dental specialty. So this book speaks about we have, as you know, that we have 10 different specialty in dentistry, orthodontics, endodontics, prosthodontics, etc. For every dental specialty, there are 100 questions, and these questions are very helpful for your DHA, MOH, or DOH exams, which are the license exams conducted in UAE, or if you or for any dental exam that you have or planning to take. This book is quite a full guide for you. And here is a sample of my book on the left side. As you can see, it's quite simple and straightforward. And it costs only $14. And the link for purchasing my book, I will upload it in the description down below. It will be uploaded on Amazon, but it will take time. Once it's uploaded on Amazon, I will upload the link. But currently, it's available on this link that I will upload. And that's it. Thank you. Hello, everyone. Welcome back to my channel. This is Dr. Zina speaking. Today, I will be speaking about what is sarcoidosis. But before we continue, make sure to smash the subscribe button down below for more and more videos. So let's start now. So let's start defining what is sarcoidosis. It is a disease involving abnormal collections of inflammatory cells that form lumps or nodules known as granuloma. The disease usually begins in the lungs, so this is the first site where sarcoidosis happens, in the lungs. Others include skin, lymph nodes, face, hands, legs, etc. So what is a granuloma? It is an area of inflammation caused by your immune system. It's made up of a cluster of white blood cells that have been walled off from the rest of your body to try to protect you from something your immune system thought was harmful. Granulomas are surrounded by fibrous, which is a dense tissue. That's why when you touch them, or you will feel that they are hard and lumpy. So you can say sarcoidosis uh, clinic, has the same clinical presentation of an allergy. Like when you are allergic to dust, your immune system will think that dust is an antigen and will start attacking it. Similar to the sarcoidosis, it will think that your white blood cells is an antigen and will start attacking it. So the overreaction of your immune system will start producing the nodules. And these nodules that will be scattered all over your body, they will be felt hard because they are surrounded by a fibrous, which is a dense tissue. Some people, they think that the nodule, if it is hard, they think that is cancer and that is the end of their lives, but actually no. You need to seek a physician in order to know if this hard lump, if it is related to sarcoidosis or if it is related to cancer. So here are several pictures for the sarcoidosis. How does it look like? Of course, it can affect the eye, it can affect the skin, it can affect even the legs. The patient will have arthritis at the end, which is inflammation of the joints. The joints basically can easily break in the end stages. Now, here is an example or a picture of the sarcoidosis affecting the lungs, which is referred to as the pulmonary sarcoidosis. As you can see, there are certain stages, which I will explain right after this slide, in which in this stage you can see that you have enlarged lymph nodes, you can have scarring, and you can have multiple granulomas that will all form in your lungs. And because the lungs are filled with such granulomas, you will have difficulty with breathing. So the main symptom that you can derive from it is the shortness of breath. Shortness of breath is the main symptom of sarcoidosis because it affects the first organ, that is the lungs. Now, here is a classification system for the lungs that was made by Schultz Patch. He stated that there are four stages for the lung classification. Stage 0, lungs and lymph nodes, they appear quite normal on an X-ray. Stage 1, granulomas in your lymph nodes only. So which means that you will start having enlarged lymph node. This is the stage 1. Stage 2, granulomas in your lymph nodes and your lungs. So you will have enlarged lymph nodes and you will have slight granulomas that will be evident on your lungs as well. Stage 3, you will have granulomas only in your lungs. It's not in your lymph nodes, it's on your lungs only. Stage 4, which is the devastating stage in which you will have pulmonary fibrosis or permanent scarring of your lungs. Now, your lungs basically is at the end stages. And because it is at the end stages, you will have difficulty with exhaling air. So what are the symptoms of sarcoidosis? The number one symptom is, as I said, shortness of breath because it targets the first organ, that is the lungs. Next is the persistent dry cough. 3, red bumps or patches on your skin, as you saw in the previous picture. You will always feel tired because the sarcoidosis attacks the lungs, and because you have shortness of breath, you will have fatigue at the end and weight loss. It can also affect your eyes. You will have a red eyes or sore eyes at all times. Because the eyes are affected, sometimes you might have vision changes and you might always need to change continuously your eyeglasses. Also, in addition to that, you might have swollen lymph nodes, and particularly in females, if they see that they have swollen lymph nodes, especially in the axillary area, they feel that this is cancer, but actually no. You might have sarcoidosis, but you don't know. So you need to check with your physician in order to know more. Lastly, of course, because as I said that sarcoidosis, it can cause arthritis, and arthritis can cause a joint or bone pain. Now I created for you a simple mnemonic in order to remember the symptoms of sarcoidosis. Once you remember the symptoms, you will remember what is sarcoidosis. Number 1 is the S. S stands for skin lesions you will have. Number 2, AR. AR stands for arthritis. So because you have arthritis, you will have a joint pain, right? Number 3, CO, which stands for cough. You will have cough. When you have a persistent dry cough, remember that this cough is coming from your lungs, and because it's coming from your lungs, meaning that the sarcoidosis attacks the first organ, that is the lungs. Fourth is the eye. Eye stands for eye, so you'll have the eyes are affected. You'll have a red eye or dry eye, etc. Lastly, you will have is doses. Doses stands for donkey, and the donkey, as you know, that he is always tired, he's always fatigued, and because of that, the patient with sarcoidosis will always feel tired. Now, what tests are used to diagnose sarcoidosis? Number 1 is the imaging test. Use special machines to take pictures of the structures inside of your body. Your healthcare provider may order chest x-rays, CT scans, or MRI. As you can see on the picture on the left side, the chest x-ray was taken, and you can see that there is a radiolucency on the right area of the tongue. Of the lung, sorry, which suggests that there is a granulomas that are being formed in the lungs. In addition to that, another way to diagnose it is by biopsies. Biopsies can be done in many different ways, depending on where your provider suspects you have granulomas, on the skin or on the conjunctiva, which is the eyes, and some lymph node biopsies can be non or minimally invasive as well. So we can also take a biopsy on the axillary lymph nodes in order to confirm our diagnosis. Now, who does sarcoidosis affect? It affects more Black people more than white people because of certain genes that they do have and the white people don't have. That's why the sarcoidosis can be seen more commonly among the African people. Now, how is sarcoidosis treated? Now, you can formulate a treatment by understanding the cause before. As I said, the cause behind the sarcoidosis is your immune system is overreacting to certain thing that is thought to be harmful, but it's actually no. So, in order to reduce our immune system or our immune response to certain threat, we need to give drugs that will cause immunosuppression. And the drugs that can cause immunosuppression, these include number one are corticosteroids. Corticosteroids like prednisolone and cortisone. These are drugs that reduce inflammation in your body because they cause immunosuppression. And these can be either taken as pills that you swallow or as an inhaler that you spray into your mouth or topical creams. So this is the number one treatment is given for patients with sarcoidosis. Number two is immunosuppressants. Immunosuppressants, they help stop your immune system from causing an organ damage and inflammation. Example of which is the methotrexate. Methotrexate is an immunosuppressant that is commonly used in sarcoidosis. Now, we talked about these, the corticosteroids and immunosuppressants. These are permanent treatments for patients with sarcoidosis. Now, what about we need to give a patient analgesic, right? We need to give an analgesic for the patient in order to relieve the patient from pain. And these include the non-steroidal anti-inflammatory drugs such as ibuprofen. These are medications that can give temporary relief of symptoms caused by inflammation. And they aren't usually prescribed for a long-term use, only for short-term use. Once you have pain, severe pain, and tolerable, you can take it. If not, then don't take it. But the corticosteroids and immunosuppressants, they should be used for your whole life.